I'm Irene Andrus, Chief Nursing Executive at the Michael Garron Hospital. Welcome to Dispatches from the Front Line. Today, I'm going to talk about a number of strategies that we use to keep patients safe. This is Bonnie, one of our locating operators. Bonnie, in the average day, how many calls would you take from either inside or outside the hospital?
Approximately 900 to 1,000.
If you were to get a call from a nurse or another healthcare provider indicating that there was a code blue on a unit, what would you do?
I would page the team, the code blue team.
Yes.
I would go overhead as to where the location is.
Right.
I would page the outreach nurse.
Okay.
I would page the chaplain. I would call the stores line.
Okay.
To let them know the time of the code.
Right.
And then about 3 to 5 minutes after, I would follow up with the unit.
Bonnie, a number of us noticed in management and in practice that there were a number of code blue canceled calls. Are you aware of what we did to kind of resolve that? Because I know the numbers have come down tremendously.
Management team has gone to the different areas and have installed a cover over the code blue button.
To avoid it being tripped accidentally by people who might be just moving through the room.
Correct.
Okay, so that was really great work. You can see the important role that the locating department plays in connecting nurses, doctors, and the healthcare providers with the help that they need when a patient is deteriorating. I'm here now with Sarah Coppinger, our Manager of Nursing Affairs. Sarah, can you tell me a bit about the work that we're doing that will help us respond well, appropriately, when patients are deteriorating in the hospital?
Well, one of the strategies that we're using is the modified early warning score.
Sarah, what is an early warning score?
It's a validated tool that alerts care providers of which patients are in danger of deterioration. And it also provides an appropriate response to escalate care.
And what triggers the response? Is it vital signs of the patient?
It's vital signs, so your temperature, respiratory rate, your heart rate or pulse, blood pressure, and more importantly, your level of consciousness. You need all 5 pieces.
I know that we have been doing a lot of work with the healthcare team on code blue response. I also know that our code blue call numbers have come down significantly in the last couple of years. What do you think has contributed to that?
Well, I think the Muse score and identifying those patients sooner is one of the things that are helping us. We are definitely using outreach more, and then we are seeing that the number of code blue responses are going down.
The Michael Garron Hospital has done a tremendous amount of work in the last couple of years related to quality improvement in supporting rescue from danger. I'm here today with Dr. Ian Fraser, who has led a team in identifying a strategy that prevents patients from deteriorating as they transfer from the ER department to our inpatient areas. Ian, can you tell us a little bit about that work?
Yeah, it's an amazing story. The team had the idea a number of years ago of identifying patients just before they were admitted.
Okay.
And to, at that point, identify if they were at high risk for deteriorating within the next 24 hours.
Right.
And to pull the stopcord to say, hey, let's take a second look and see if we can treat them better. And
So we would actually stop them in the ER department,
absolutely.
Is that it? Oh, okay.
But what amazed me, we had a 50% reduction in the number of deteriorations within a year of implementing the project.
So when you say deteriorations, that translates to code blues.
Well, it translates into code blues, outreach team calls.
Okay.
It was quite amazing. And you know what? We did it at the same time without increasing the number of ICU admissions or delaying the transfer for all the rest of the other patients to wards safely. So our wait times were great.
That is a fantastic story. Thanks for sharing that with us today. 2 essentials in quality patient care are teamwork and communication. Today we saw how healthcare providers in the locating department and also at the front lines are helping us provide the best and safest care to our patients. Thank you for joining me today in Dispatches from the Front Line.